Logo, HRQ. Agency for Healthcare Research and Quality. Department of Health and Human Services. USA. A patient waits in a doctor's exam room.
Hello, Ms. Roberts.
The nurse washes her hands.
My name is Jennifer. I'm your nurse.
She picks up a clipboard and approaches Ms. Roberts.
It says here that you're having a headache. Can you tell me more?
Ms. Roberts shakes her head.
I've had a headache for the past 2 days, and it's not getting any better. I've taken medication for the pain every 6 hours, and it's just getting worse.
It says here that you're a new mom. When did you deliver your baby?
I had my daughter 9 days ago, and I love being a mom, but between getting up every 2 hours to feed her and this pain that just won't go away, I'm completely exhausted.
I'm sorry, you're not feeling well. Your blood pressure is 160/110, which is very high. Dr. Matthews has ordered Tylenol for your headache and labetalol for your blood pressure. He'll be in shortly to examine you.
Okay.
Nurse Jennifer closes the door on her way out. Dr. Matthews comes in.
Hi, Ms. Roberts.
Hi.
He cleans his hands.
I'm Dr. Matthews. And I understand you've been having a headache for 2 days. Are there any other symptoms?
Ms. Roberts' arms are folded across her chest.
Well, my hands have been swollen recently, but I don't know if that's related.
Any difficulty breathing or pain in your chest?
No.
Did you have problems with your blood pressure before or during your pregnancy?
No, but several of my family members do take high blood pressure medication.
Oh, okay. All right, well, I'd like to start examining you.
Okay.
Using an ophthalmoscope, Dr. Matthews examines Ms. Roberts' eyes. Text, exam results. Blood pressure, 160/110. Heart rate, 69. Pain score, 8 out of 10. On exam, Ms. Roberts is somewhat anxious and tearful. She has no signs of head trauma and her pupils are of equal size and reactive to light.
So your exam is normal. So let's give the medication some time to work. I'm going to have the nurse recheck your blood pressure in about 30 minutes.
Okay.
Dr. Matthews leaves the room. Text, 30 minutes later.
Hi, Mrs. Roberts. How are you feeling now?
She shakes her head.
My head still hurts, and my vision is a little blurry now.
Text, repeat vital signs.
Your blood pressure did come down a little.
Blood pressure 150/90.
I think you're just tired and stressed out from being a new mother. And you probably have underlying high blood pressure, but you didn't know it. I'm going to give you a prescription for some blood pressure medication, and I'd like you to follow up with your OB in a couple of days.
Okay.
As the doctor turns away, Ms. Roberts covers her face with her hands.
Ms. Roberts, what's wrong?
Nurse Jennifer approaches Ms. Roberts.
My head still hurts, and I don't know how I'm going to take care of my baby like this. My vision is blurry, and the doctor told me I should just go home and rest.
The nurse looks through the chart notes.
Your blood pressure is still high. I'm going to speak with Dr. Matthews.
Thank you.
Jennifer leaves the room. She approaches Dr. Matthews where he is standing by the nurse's station.
Dr. Matthews, I am concerned that Ms. Roberts' blood pressure is still high. She delivered a baby less than 2 weeks ago. Do you think this could be preeclampsia?
She's just a new mom who's tired and needs to get some rest. Who knows what kind of prenatal care she received. And she's probably had high blood pressure for years and didn't know it.
Dr. Matthews, she's crying. I am uncomfortable discharging a postpartum patient with elevated blood pressure and a headache.
But her BP came down with just 1 dose of the medication, and she's going to see her OB in a couple days.
But she still has a headache, and she says her vision is blurry. Her hands are also swollen. I am worried about preeclampsia, and I think sending her home without further evaluation is a safety issue. Would you mind contacting her OB directly?
Thanks for your openness in voicing your concerns. I'll give the OB a call and get another opinion.
Jennifer hands Dr. Matthews the chart note folder. They then go their separate ways. Ms. Roberts, in the exam room, covers her face with her hands. Dr. Matthews enters.
Ms. Roberts, your nurse Jennifer told me you were crying and is very concerned about sending you home. I called your obstetrician and she asked that we check your urine and take some blood samples to make sure this is not preeclampsia. We'll keep checking your blood pressure, and I will call your obstetrician as soon as the labs are back.
Thank you so much, Dr. Matthews. Thank you.
Dr. Matthews puts his hand on Ms. Roberts' shoulder, then leaves the room. She breathes a sigh of relief.